Good morning, everybody. Sorry to be a little late. We're having a few technical difficulties, which often goes on with virtual events like this, so appreciate very much your patience. I'm Dr. Paul Simeone, VP Medical Director of Behavioral Health at Lee Health, and it's my great pleasure to welcome you to today's event. As we get started today, I'd like to acknowledge the organizations that helped make this possible, without whom we could not make it happen. I'd like to start by thanking Lee Health, Alessandro Children's Hospital, Kids Minds Matter, and Healthy Lee for sponsoring this event. Kids Minds Matter continues to raise awareness and essential funding to enhance pediatric behavioral health programs and services in Southwest Florida and community partners, through community partners. It's through collaborations such as this that provide professionals the opportunity to learn from experts across the realms of mental and behavioral health care. Next, I'd like to acknowledge the amazing worker bees behind the scenes, without which today would not be possible. Those worker bees are Cheryl Schlichter from Healthy Lee, Lauren Walker, Program Manager from the Center of Population Health at Lee Health, and Megan Palumbo at Park Royal Hospital. Thank you for your dedication, your resources, and time in making this event a success. Finally, I want to describe the format for today and what you can expect from a virtual mental health fair. You've already gotten a little bit of taste of it by the technical problems we've had. And again, we apologize for that. As many of you remember, we put on this fair at the Barbara B. Mann Center in late spring of 2019. It was met with such great appreciation that we decided to host it again this year. Then COVID came. So the mission became how to offer all of these great functions, but to do so on a virtual platform. I'm going to offer a few high-level points to help you understand the overall platform, and then we'll get started. We'll get the day started. First, we're going to hear from our keynote speaker, whom I'll introduce momentarily. Then 7 presenters will come up individually to share information about their services. Once all 7 presenters have shared, they will coordinate over a panel table. At this point, the audience will have a few minutes to ask them questions pertaining to the services they just heard about. You will use the chat box for this question and answer session. Just make sure you address the question to the specific organization. After the first presenters and the Q&A session, we will simply rinse, wash, and repeat. Therefore, we'll have 3 groups of presenters all told. And next, we'll hear an update on the care navigators that are in the schools. This is a project that is near and dear to my heart, and I'll have a few words to say by way of introduction. And then, because this has been sponsored by Kids Minds Matter and Suncoast Credit Union. And finally, some quick updates on some very exciting community initiatives that I, along with a bunch of other people, will put on the table. All right, that was a lot, and I think that you're going to be in for a really great morning, hopefully stretching into the afternoon. So as promised, I'd like to now introduce you to our very special guest, Shannon Wisely. Shannon is a licensed mental health counselor specializing in maternal mental health. Shannon currently practices right here in Fort Myers, and is one of only a very few people specializing in this very important area of counseling. I think we'll agree after hearing from Shannon that this is an area that oftentimes doesn't get enough attention, and so it's good that we have her here reminding of the importance of it. Please help me welcome Shannon to the stage.
Hi, thank you everyone. It is such an honor to be here with you today. My name is Shannon Wisely, and I'm a licensed mental health counselor practicing here in Fort Myers. Over the years, I have worked as a therapist in many different settings and with several different client populations. In 2013, I made the decision to devote my career to the field of maternal mental health. This path was made clear to me after my own experience of postpartum distress following the birth of my first child. I found out that there were no mental health clinicians in Southwest Florida who had specialized training in this area. I received my postgraduate training through Postpartum Support International and now provide counseling to pregnant and postpartum women and those struggling with infertility or grief from loss. I most commonly see women who are struggling with anxiety or depression, either during pregnancy or during the postpartum period. Sadly, I also see a great number of women who are experiencing post-traumatic symptoms following the events from a traumatic birth. When I'm not working directly with clients, I can often be found giving presentations like this to different groups of people within our community. Educating medical professionals, social workers, and groups of moms alike on the topic of maternal mental health is such an important part of my work. The phrase maternal mental health is a relatively newer term that encompasses all aspects of mental health that can afflict a woman during her perinatal years. The term perinatal refers to the period of time surrounding pregnancy, birth, and postpartum. Maternal mental health, or its synonym, perinatal mental health, replace the outdated and limiting term postpartum depression. I'm sure that most of you have heard of postpartum depression. In fact, since 1 in 5 women experience this very common illness, it is likely that you or someone you know has suffered from it. Furthermore, since the 1 in 5 statistic only includes the number of women who have been identified by their medical providers, most experts in my field believe that the number is actually much higher. The problem is that postpartum depression is a misleading and limiting term that can lead to confusion and underdiagnosis. We now know that emotional struggles don't always occur during the postpartum phase and can begin during pregnancy or at any time during the first postpartum year. Another issue is that the symptoms don't always look like depression. In fact, it is now understood that symptoms of anxiety are actually more prevalent than depressive symptoms during the perinatal time. The umbrella term, perinatal mood and anxiety disorders, or PMADS for short, was created in order to encompass the wide range of symptomology that women can experience during this time. In addition to perinatal depression and anxiety, experts have been able to identify several other conditions. We now understand that for some women, their suffering is characterized by intrusive and scary thoughts. This disorder is called perinatal OCD, or obsessive compulsive disorder. Some women experience a trauma response that can occur following a traumatic pregnancy or birth event. Most often, those symptoms are marked by avoidance, hyperarousal, nightmares, and even flashbacks. We diagnose this as perinatal PTSD. And perhaps the most severe example of perinatal distress is that of perinatal psychosis. This is a rare but serious condition that requires emergency treatment. This is when the mother enters a psychotic state and is at great risk for harm to herself and others. Many of these disorders can overlap or share symptoms. All require important distinctions in diagnosis that must be made by a trained professional. These distinctions are sometimes a matter of life or death. In fact, recent research suggests that maternal suicide is one of the leading causes of death during pregnancy and the first postpartum year. As you can see, there are many ways that emotional distress can display itself, and things aren't always what they seem. Some of my most severe cases have been women who appear from the outside to have it all together. Hair and makeup done, well-dressed, eloquent, all the while extremely depressed and having dark and scary thoughts. You can't always tell who is struggling from outward appearance. That brings me to my next point. Maternal mental health issues do not discriminate. These difficulties can happen to anyone, regardless of age, ethnicity, religious beliefs, financial and educational status, or the amount of support one has. These issues are pervasive and affect millions of women every day. But yet, many women are never even screened by their OBs for mental health issues, and even fewer ever receive treatment. But how could this be? For a problem that has existed since the beginning of time and is so prevalent. In my clinical observation, it comes down to one word. That word is stigma. Stigma. In other words, the shame, disgrace, and humiliation. Mental health problems in general have always carried a great deal of stigma within our society. We do not view mental health the same way as physical health. People are much more comfortable telling you that they have kidney stones than they are telling you that they have depression. Any pregnant woman can tell you how much emphasis is placed upon her physical health, how big the baby is measuring. Is she receiving education on the warning signs of preeclampsia? Having the glucose test for gestational diabetes. The list goes on and on. And yet, a pregnant patient is almost never asked about her mental and emotional state. At a 20% incident rate, that puts perinatal depression and anxiety as the most common complication of childbirth. That's more common than gestational diabetes and preeclampsia combined. Also, there is an added layer of stigma associated with maternal mental health that is unlike other mental health problems. The myth of motherhood. Motherhood has long been regarded in our society as a magical time of joy and love and sunshine and rainbows. And for many women, it's anything but. Many women are so ashamed and fraught with guilt that they do not even tell their partners or closest friends how badly they're feeling, for fear of being viewed as a bad mother. I've had many clients tell me that they were so afraid of their thoughts that they believed their children would be taken away from them if anyone knew what they were thinking. Almost every client I've ever seen has said that they thought they were the only one who ever felt this way, and that nobody ever told them this could happen. Our expectations of what motherhood will be like are not always met, and women often feel inadequate when their reality does not match their expectations. The truth is, becoming a mother is hard, even under the best of circumstances. So what can we do to break down the stigma associated with maternal mental health and get women the help they so desperately need? If you're a mental health provider, it is crucial to assess the pregnancy and postpartum status of your clients. You are in a position to educate your client on the prevalence and encourage treatment options. If you are still in the childbearing years, please don't be afraid to reach out and talk to someone if you are feeling anxious or depressed. With the right treatment, most women make quick and full recoveries. You are past this stage, but have gone through this yourself. Don't be afraid to tell other women your story. Normalizing these experiences helps women to feel they are not alone. And for all of us, if you have a friend, a sister, a cousin who is pregnant or recently had a baby, don't be afraid to ask her how she's feeling emotionally. Look her in the eyes and ask the real questions. Let her know that you care about her and offer your support. Encourage her to talk to her doctor and find a therapist who can help. Doing this could literally save someone's life. While resources for pregnant and postpartum women remain limited, there is hope. As I mentioned a moment ago, the prognosis for maternal mental health As I mentioned a moment ago, the prognosis for maternal mental health disorders is quite good. With the appropriate treatment, women do get better. Medication, therapy, and support groups are the gold standard of care. Postpartum Support International is a great resource for anyone seeking therapists and psychiatrists who are trained in this field. They also offer free online support groups for moms and dads. In 2016, the U.S. Preventative Services Task Force recommended that all obstetric and pediatric practices begin screening pregnant and postpartum women for depression. Many practices have begun to use the Edinburgh Postnatal Depression Scale with their patients. This is a 10-question screening tool that asks questions about depressive and anxious symptoms and about thoughts of self-harm. And while this is an important step towards identifying and treating more women, it has its flaws. I've had many women tell me that they were too afraid to answer the questions truthfully. Worse yet, I've had women tell me that they answered the questions in such a way that would surely indicate severe depression or high anxiety, but their results were never discussed with them. We still have so much further to go. Becoming a mother is a magnificent, joyous, and rewarding process, but it is also scary, thankless, overwhelming, and the most difficult transition a woman can experience in her life. Having a baby can unearth past emotional wounds, rock an otherwise stable relationship, and has the power to change a woman's identity. This is no small thing. And through greater awareness and communication, I believe that mothers can gain the support and recognition they so deserve. Thank you so much.
Shannon, that was really spectacular. Thank you for such a rich, thoughtful, and informative talk about something that I know, speaking personally, the area that you're talking about is something that, particularly as a man, worries me a lot. And so I really appreciate the wisdom that you've shown us today. And you are a real community gem. And we appreciate all the work you're doing. So what I'd like to do is to invite you back. And just talk a little bit about the services you provide. Just to, very briefly go through what it is that you do and how we can best use you. So if you don't mind, thank you very much.
Hello, me again. As I mentioned before, my name is Shannon Wisely, and I am the lead therapist for Shannon Wisely Counseling. We provide mental health counseling to pregnant and postpartum moms and those struggling with fertility difficulties and grief issues from perinatal loss. I have 2 associate counselors as well as graduate students who are able to offer a range of fees for services. We are located on College Parkway in Fort Myers, Florida, and you can find more information and contact us through my website, which is just shannonwisely.com. Thank you.
Thank you, Shannon. Next, we're going to hear from Jessica Plazowski from Sailors Care. Jessica.
Good morning. My name is Jessica Plazowski. I'm the Vice President and Interim COO for Sailors Care. I'm really honored to be here this morning to talk with you all about the services in which Sailors Care provides to our community. So our provider is a not-for-profit in which we treat all individuals regardless of their ability to pay. And so we think about our services in 4 different subdivisions. And the first subdivision is acute care. Acute care we think of as detox, crisis stabilization, and also our juvenile addiction receiving facility. At Sailors Care, we have a detoxification program that we currently operate 20 beds. We have an adolescent crisis unit in which we operate 16 beds, and an adult crisis unit in which we operate 30 beds. When we think of acute care, we think of that as the highest level of care in which our community can provide outside of an inpatient hospitalization, such as a state hospital. Below the step of acute care, we have residential services. We have an adolescent substance use program that is inpatient that offers 20 beds, as well as an adult inpatient substance use program that has 20 beds. At that campus, we also have day treatment, transitional living, and recovery residents, where we have an on-site live-in peer who works within the community to provide help to those in their recovery. The next step down from care is our community-based programming. This type of programming is services that are provided in the community setting to individuals who need them in their natural environments. So think of case management, both for adults and for children. Excuse me. We offer these services for those who have a mental health diagnosis, substance use disorder, and/or a co-occurring diagnosis. We also offer in-home therapy such as TBOS and forensic services for those involved in the criminal justice system. We also work closely with individuals who are identified as high need, high utilizers of our higher levels of care, such as acute care. And lastly, we provide outpatient services. We have 7 locations total for the organization, plus 1 office in the Goodwill Job Link Center in Lehigh. Our outpatient services consist of outpatient psychiatry, both for adults and adolescents. We also have outpatient therapy, psychiatry, and medication-assisted treatment, in which we work with individuals who have a diagnosis of a substance use disorder associated with opioids or alcohol. And we also have several partnerships with the school district to where we provide referral services for those identified with a threat assessment team and have a clinician on site at Success Academy. We recently had another MOU approved with the school district to provide services relevant to individuals who have been affected by COVID. And we're looking forward to starting that program to assist our children in the schools. If you ever need any assistance or have questions, you can visit our website at www.salescareflorida.org, or you can call our Welcome Center at 239-275-3222. If any individuals you're working with are experiencing a mental health crisis, they can certainly contact our emergency services at 239-275-4242. Thank you so much.
Thanks very much, Jessica. And thanks for all the great work that Sailors Care is doing. Next, we have the pleasure of hearing from Jessica Lyria from the David Lawrence Centers.
Hello, good morning. I am Jessica Lyria. I am one of the outreach specialists with David Lawrence Centers for Behavioral Health. Very similar to Salis Care, however, we are located in Collier County with offices in Naples and in Immokalee. We are a community-based not-for-profit that has been in the community since 1968. We offer behavioral health services to youth and adults as young as 2 years old. We have over 350 staff and volunteers, as well as over 40 programs to meet the needs of the community. We have comprehensive services meeting all levels of care, starting from prevention services all the way to crisis. Some of the examples of our services would be youth and adult outpatient, which includes individual, group, and family therapy, as well as free parenting programs and more. We have a substance use continuum for adults, starting with detox. We have a residential facility, as well as partial hospitalization and intensive outpatient. We have child and adolescent services, which are community-based, being able to be in the community, at the home, in the schools, to advocate on behalf of those youth that are struggling in those settings. We also have a managing emotions group, which is specifically for high school aged girls suffering from some depression, anxiety, and similar situations. We have case management and peer specialist services to be able to provide that extra level of support for those in need. We have emergency services and crisis stabilization. We are the Baker Act receiving facility in Collier County. And we also have specialty treatment courts and child welfare involved services. You can access care in many ways. We have a walk-in service to be able to have a clinical assessment and identify all of the needs so that we can link you with the most appropriate program we have. We also have a virtual care center, which was launched due to COVID. So you can go to dlcenters.org and all of the documents are there to be able to fill out. You'll be contacted within 24 to 48 business hours to schedule an appointment. We also have our Emergency Services Assessment Center, which is open 24/7, 365 days a year. Our clinical assessments take 1 hour, where we have a financial counselor available to look at insurance benefits or even do a sliding scale discount and possibly work out payment plans. We try to reduce all barriers to the community to be able to link with our services. And we also have an on-site pharmacy and primary care provider through our community partnerships with Genoa Pharmacy and Healthcare Network of Southwest Florida, so
that we can be a one-stop shop for everyone to be able to get all their needs satisfied on one campus. Thank you so much for your time and have a wonderful day.
Jessica, thanks so much for your presentation and all the great work that David Lawrence Centers are doing. Thank you very much. Next, we have Jamie Hodges from Lee Health's Behavioral Health Clinic. Jamie?
Good morning, everybody. Thank you for having me here. Just share a little quickly about our offices. I'm here to talk about two. I'm the director for the Behavioral Health Center and the Recovery Medicine Office within Lee Health. First, the Lee Behavioral Health Center. We're a traditional outpatient office offering counseling services and med management services. We have licensed clinical social workers providing the counseling and a combination of psychiatrists and nurse practitioners providing medication management. We do have limited case management services available. We are a contracted provider with Central Florida Behavioral Health Network. We have contract with Home Base of Southwest Florida, provide services in collaboration with Lee County government, with some of their EMS workers, and of course, various different insurances, Medicare, Medicaid, and pretty much all of the commercial payers. We're open Monday through Friday, typical outpatient office. We have some limited evening hours for counseling at this time. Our phone number for access to referrals for new patients, just give us a call at 239-343-9180. We are one office. Prior to this pandemic, our plans were to grow and expand into several different locations. As with everybody else, those plans kind of got put on hold. So as things start to slow down and get back to a little more sense of normalcy, we are beginning the discussions again to see how we can grow and expand within the community, because we know there's a great need. The other office, LPG Recovery Medicine. We offer, again, traditional outpatient office. We offer MAT, medication assisted therapies for various substance use disorders. We have 2 addiction specialists and 1 licensed clinical social worker that offers counseling up there. That office is pretty new still, about 1.5 years in existence, so it's still growing. And the plans remain for them as well to open up additional locations and embed hopefully within other offices in Lee Health. Phone number for new patient referrals for that is 239-343-9190. Don't worry if you dial the wrong number. If you get one office or the other, we'll be happy to transfer you to the right one you want. So thank you very much.
Thanks, Jamie. Jamie's a wonderful colleague who does great work running a really good clinic at Lee Health. Thanks very much. Next, we have the pleasure of meeting Susan Vivanetta from the Collier County Sheriff's Office. Susan?
Thank you. Good morning. I am Susan Vivanetta with the Mental Health Bureau of the Collier County Sheriff's Office. You'll see on your agenda, you were expecting Sergeant Tom Tavery, and he had planned to be here till the last minute when he got a call out. So he's out in our community helping out with a crisis situation. Our Mental Health Bureau currently consists of 2 certified deputies. We're expecting a 3rd, hopefully very soon. We also have a CIT coordinator, a crisis intervention team coordinator, a mental health bureau coordinator, and 2 licensed social workers. We're excited to have the licensed social workers. We contract them from the David Lawrence Center. And one of the reasons we needed their assistance is because we have put together mental health intervention teams, which means that we have a certified deputy, certified law enforcement officer, and a licensed social worker who can go out into the community and address crisis situations. They do this through referrals from the agency. They may come into as a 911 call, or we may get referrals from community members or community partners where they can go out and check up on someone, make sure, they can assess the situation, they can assess the person, and also they typically can go into or welcomed into the home of this individual, and that way they can assess their living situation, because there are a lot of signs of mental health crisis situations just by looking around a house and seeing what their living conditions are. If they have food in the house, if they are hoarding, if they are blocking windows and doorways and different things that might be a sign of some sort of mental health crisis. We also provide crisis intervention team training, that's CIT training, which is a 40-hour training on mental health issues. And we provide this to all of our law enforcement officers and corrections officers. Right now with law enforcement officers, we are probably about 95% through all of our certified law enforcement officers. Corrections is probably 50% because they started a little later, but we've been offering CIT training since 2008. We started with our patrol officers, and we've just kind of, as we can move through and get everybody trained, we've moved on to other positions like criminal investigations and corrections. It was really needed in corrections, so we're happy to be able to host them. We also include Naples Police Department, Marco Island Police Department in those, and the National Park Service usually sends a representative for the 40-hour training, which has been terrific. We do a shortened version for our 911 in our dispatch center because they need the crisis intervention team training as well. How we do the 40 hours is we include our community partners, the experts in those agencies to come in and talk about different topics, whether it be mental health signs and symptoms or autism spectrum disorder. We talk about elder issues because a lot of times our elders are having issues that are hard to determine between whether it's dementia or a mental health illness. So we have that addressed and many other topics. We also teach mental health first aid, which is an 8-hour certification course that can be taught to anyone in the community. So we've done different groups. One of the things that we are proud of is that we offer this training to our inmates, or we were before COVID. So we will take this 8-hour certification class, and over a period of time, we talk to inmates and teach them about mental health issues and signs and symptoms, and that's been very successful. We have had to delay that due to COVID, so we're hopefully going to get back to that soon. We're also heavily involved in the county treatment courts. Our treatment courts include mental health court, veterans court, and drug court. So we're involved in the actual court dates. We participate along with a team of mental health counselors from David Lawrence Center. There is a dedicated state attorney and a dedicated public defender, a dedicated probation officer, and then also corrections is involved in this, as they are one of the primary referrals for people to get into these diversion courts. And that has been very successful under the Honorable Janice Martin. She's been a great leader, and the program has been very successful over the years. With that, we also are able to do wellness checks, and we do checks with the probation officers to make sure that a particular individual that's been called to our attention is doing okay. So we'll go out and check on them. And to make all of this successful, we heavily depend on our community partnerships with David Lawrence Center, with the FACT team, with Naples Community Hospital, with NAMI, and the Collier County Public Schools. We're very involved with the Collier County Public Schools and assisting them. We also provide services to our agency members in various ways. And one of that is our critical incident stress management team. When there is a critical traumatic event that happens, you know, it would be happening in the community, but all the law enforcement officers and firefighters and EMS workers that are involved, we will do defusings and debriefings with them to help start the process of dealing with that event. And then we also assist the courts with serving ex parte orders, and those are orders from a judge when a family member or typically a family member knows that there's a crisis, mental health crisis going on with one of their loved ones. They can petition the court to have that individual Baker acted. And so if the judge approves that, they give us the paperwork. And so the Mental Health Bureau can go out and take that person into protective custody and take them to David Lawrence Center, which is our receiving facility. So that's pretty much it. Of course, there's a lot of, as all of there's a lot of other things that go on within the department that we address as well. So I thank you for your time and for being included in the program.
Susan, thank you very much for that presentation and for doing what what we all know is extremely difficult but absolutely essential work in the jails. Just as a point of personal uh, um, connection, I've had the opportunity of working really closely with Judge Martin and Sergeant Weidenhammer in Collier, and I can tell you they're doing some amazing, groundbreaking work down there. So thanks to them for all they're doing in Collier County. Last person in this particular slate of presenters is Gina Britton from NAMI Lee, and Corey Lazar, who's our friend from Wake News and a fellow board member with me on NAMI board, asked me to do a shameless plug for the NAMI walk tomorrow. And so, since I'm shameless many times, I'm just going to give that plug, and I hope Gina will provide some additional details on that. Gina, please.
Thank you, everybody, for having me here, having all of us here. I always look forward to the opportunity to hear about what's new, what's upcoming with our local resources. I'm Gina Britton. I'm the program director for NAMI Lee, Charlotte, and Hendry counties. We were NAMI Lee for many, many years, but when we realized there was such a lack of NAMI support in Charlotte and Hendry, we decided to take on that challenge too, to try to bring some of our services into those more underserved and rural areas. The services we offer are many. And they're mostly peer and family centered. First of all, we have information and referral helpline. I like to think of NAMI as the United Way 211 of mental health services, right? We collect up all the data that we can about what resources are in the area, what the providers are, who they are, what they offer, who works on a sliding fee scale, who doesn't, and we have all this in a giant repository. And so when anybody calls and they say that they need help, I don't know where to find it, we can help them do that. And it's not just, mental health service providers. We can also help them with peripheral things like finding a way to get into housing or get their benefits, or maybe some other options that are out there to help them, maybe, medication discounts, things like that. And that information referral line is staffed by people who've been there. They know the system, they know how it works, they know how challenging it is, and they can guide people or family members to whatever it is that they might be in need of at that present time. We also offer a whole bunch of, well, at least before COVID, we offered a whole bunch of support groups, peer support groups. We have groups for individuals with mental health conditions where they can support one another in a confidential, empathetic, understanding way. We are doing those on Zoom every week, so we do still have that, but we don't have all the different locations like we did before. Hopefully we will soon. We have a peer support group for mental health court participants. It's strictly for them, where they can talk about all the issues that they deal with being in that program. It's a very difficult program. It's very rewarding and very, very successful, but it is very difficult and demanding. And that one is run by people who've been through the program, so they can encourage them and help them along, give them tips and different things that they can do to make life a little easier. We also have a veterans group that we are doing. These are the ones we're still doing on Zoom. And that's for veterans, whether they're in veterans court or not, just any veteran, because they can relate to other vets better than they can just the general public. We have family support groups. Family members come to the support groups to learn from one another, to get some guidance, some understanding. Usually they come to us when their loved one falls ill and they just don't know what to do. They don't know where to start. No one had ever told them that this is a possibility of happening. So they come to NAMI, and NAMI sets them on a path of discovering what's available, how to get started, things that they can do, ways that they can help support their loved one. We also offer really great education courses. We have one that's called Peer to Peer, And it's taught by people who are in recovery from a mental health and maybe a substance use issues. And they teach other people about what they did that made them so successful at recovering. It explains the mental illnesses. Some of these people who have these illnesses have never been educated about what their illness actually means or what it does. So they'll get a whole bunch of information and a whole bunch of guidance on different ways to stay strong and work through it and stay in treatment and all the things that they need to stay healthy. We also have a similar one called Family to Family, and it's the same thing. Family members will teach other family members, hey, here's what we had to go through. I know what you're going through. Here's how we dealt with it. They educate the families about mental illness because oftentimes they don't understand their loved one. They just think maybe they're lazy or unmotivated or just something, you know, they just don't understand mental illnesses. And once they get a clearer picture that these are illnesses that these people did not ask for, they cannot help, you find that the relationships between family members and the loved one, they improve dramatically. We also offer mental health first aid. We offer adult, we offer youth and public safety. And then they now have a combination, adult and youth, we offer that. And in conjunction with the Southwest Florida Public Service Academy, we are the coordinators for Lee County's CIT program, which is a wonderful program. I'm so glad you explained it so I don't have to again. We offer special courses we offer the traditional 40-hour for patrol, campus police, but we also offer a different version for school resource officers and another version for corrections officers. And hopefully by, it might not be spring now, it might have to be postponed a little bit, but we're gonna start offering dispatcher courses. So that's kind of NAMI in a nutshell. And if anybody needs help, they just reach out to us at 239-337-9024, or they can email anytime they want at info@namilee.org. Thank you.
Thanks so much, Gina. NAMI does great work wherever they are, and really appreciate everything that you were describing. At this point, we're going to move to our Q&A, our panel discussion. Please, if you have questions, put them in the chat box. Megan Palumbo is going to be our moderator. She will read them out. And please remember also to specify the organization to which the questions are directed. Thanks very much. Don't be shy out there. This is a great opportunity to have your questions answered by some really great presenters. By the way, I just got a text from one of our senior leaders at Lee saying how wonderful the presentations were and how delighted he is that, that we've gotten this together and everybody's participating. So thank you again.
Thank you, Dr. Simeone. Actually, we did get a question here in the chat for NAMI, Miss Gina Britton. If you could tell us a little bit more about World Mental Health Day this Saturday and the virtual walk this year and what that looks like for Lee County.
Can you hear me all right? Okay. Yeah, another shameless plug. Yeah, we are so excited about this. Usually every year we have a huge awareness walk, and it's called NAMI Walks. And we start in Centennial Park, and we walk all the way down Edwards across the bridge and back. And every year it's gotten bigger and bigger. We had over 834, I think, was walkers last year, and a big festival and food trucks, and COVID, of course, put the kiboshes on that this year. So what we decided to do instead is to hold a virtual NAMI Walks Your Way on World National Health Day on October 10th. along with other NAMI affiliates throughout the country who had the same thing happen to them. So it's very easy. You don't even really have to walk. You can hula hoop, you can knit a blanket, you can just, shoot a little video. You can do all, whatever you want just to help support us and raise awareness for the importance of mental health and for NAMI and its services. So it is a fundraiser. But you don't have to donate to participate. We just want people, the more people that are on our number ticking up, this how many people participated, it just goes to show how our community can come together and say, hey, we need more mental health resources here. We need to draw attention to the crisis that's probably coming in mental health due to COVID. So we have some things planned during the day. Go on Facebook, like our Facebook page. We're going to be doing some live streaming. We have some great video testimonials. We have pictures to show of what everybody is doing for their NAMI Walks Your Way this year.
You'll see me walking my 2 dogs in my neighborhood. It's not pretty, but it's functional. Let's put it that way.
Yeah. So that's what it's about. And we just hope that everybody will go on our website, scroll down to the NAMI Walks Your Way, and just take a look at it and get involved.
Thanks very much, Gina.
Mm-hmm.
If there are people here who have questions and you want to ask them live, I'm happy to bring the mic over and give it to you. I have a question for Shannon. Can you speak, 2 questions actually, separate but related. One is, in my own work as a clinical psychologist, I have seen, you talked about trauma, the trauma of a difficult birth experience, or just a birth experience that experienced is traumatic. What I've seen is the birthing experience as reawakening old trauma, and wanted to know what your experience was with that. And then the other question I have is, what kinds of services would you recommend for husbands and fathers going through this? Because I've seen a lot of that in my practice, and I think they're sort of neglected as well. So if you wouldn't mind.
Okay, those are very good questions. Addressing the issue of trauma first, I think what you're asking is if giving birth or having a traumatic birth event can awaken old trauma, trigger old trauma from past events. And we do know that is definitely possible. In fact, women who have had past trauma, even if it is unrelated to their perinatal phase completely, whether it is past abuse or any kind of especially sexual assault. We do know that birth and the treatment during pregnancy can absolutely kind of re-trigger those old traumas from the past. And so having those events can put a woman at higher risk to experiencing perinatal PTSD and or depression, anxiety. And that would be a part of the treatment for her. So not just focusing on the current traumatic event, but probably also going back into her past to find out and treat some of those old traumas as well. Yes. So your second question about partners. Yes. Yep. So for me personally, I always welcome the partner to join in on at least one session. I think it's very important for partners to be aware, to be educated about what's going on with their partner, what signs and symptoms to look for. When I work with pregnancy, I will oftentimes have the partner come in during pregnancy to prepare them for the postpartum period and what to expect, what to look out for, what to listen for. And that really, really helps build that support system for the client and can actually prevent some of these challenges from becoming or from arising if we can get the education support set up ahead of time. Another thing is that postpartum or perinatal depression anxiety is not limited to just the partner who's giving birth or is pregnant. Fathers and partners can absolutely experience these issues as well. So in that case, I would maybe even see the partner as the primary client, and that would be totally fine. And as I mentioned before, Postpartum Support International, the professional organization that I belong to, has specific group support groups online for dads that are specifically for fathers and or partners.
Thank you very much.
You're welcome.
We're actually going to jump over to Salus Care. Jessica, our next question is from one of our peer support specialists, Carilla. So thank you, Carilla. She works in the Lee Healthcare System, so a relatively new application for us here in Lee County. And she was asking about what medications does Salus Care offer in their medication-assisted treatment program?
Really great question. Thank you for that. So in our medication-assisted treatment program, we utilize medications such as Vivitrol, Suboxone, Subutex, and a variety of other types of medications that an individual might be in need of to support their recovery. We do not prescribe methadone. I believe the only methadone provider in our area for Lee County is Operation PAR. So if that's something that the individual is interested in, we certainly will help link them to that resource so that they can utilize the method in which they feel is best for them. And while they go through the assessment process with either our addiction specialist, who's also our medical director, or the nurse practitioner who works in the program, they'll go over all those options. What is the person looking for in their recovery? Are they wanting to be on something long-term? Are they wanting to be on something short-term? And really developing a treatment plan that is conducive to that person's recovery. We also ensure that in any of our residential programs, if somebody is on medication-assisted treatment, that they have access to those services as well. We don't discriminate.
Thank you so much. We have our next question for Lee Health, Jamie. What increases are you seeing for behavioral health needs since coronavirus?
Oh goodness. We've seen, as I'm sure everybody else has seen in the community, a very large increase in just support and services needed to handle multiple life stressors, whether it's loss of job, loss of income, financial instability, loss of loved ones, can't visit someone in a nursing home, just loss of connection. And just the fear and uncertainty of the future. What's next? How long? When is this going to stop? I'm afraid to go out of the house. Very thankful the community has been when we were able to provide telemedicine visits, because about half of for the Behavioral Health Center, about half of our client population is of Medicare age. And so very fearful in the beginning of leaving their house. You know, a lot of co-occurring medical conditions, chronic health conditions. So being able to provide that support was very vital. But we've seen, and as I'm sure everybody else has seen, a large increase in just need and demand in the community. So we're trying to do, as everybody else is, the best we can to meet the needs of the community, and we're going to continue to do what we can. So even within the healthcare system, employees, nurses, doctors, advanced providers, you know, our own staff members struggling with the pandemic and the uncertainty and just the stress that has been placed on top of our healthcare workers as well. So.
Very interesting that you added that side of it for healthcare workers. Something that we haven't really been giving a lot of thought to is how this is all affecting our people on the front lines. So thank you to all of our panelists who have been responding to the behavioral health needs of this pandemic. The next question, actually, we're going to jump back to the maternal mental health professional on our panel. How do you think we can be better supporting maternal mental health in our community?
Another great question. Thank you. So, as I mentioned in my presentation, that when I had first set out on this career path, this specialization, I was shocked to learn that there were no providers in our area who specialized in maternal mental health, and still to this day, I am one of the very few providers in this area that does this. And so we definitely need more therapists, psychiatrists, psychologists, caseworkers, social workers. We need more of training in maternal mental health. But again, this is something that is, kind of limited in even resources for training. So I would I guess, direct back to Postpartum Support International. They offer a really great training program for any clinician who would like to receive more training and education in this area. And also, there's other organizations that do that as well, that offer that specialized training. And I think it would definitely be a great thing if more clinicians in our area could become trained, and so that we could serve more women. I believe there are, I don't know if I'm getting this number right, but I'm pretty sure there are 500 babies born in Lee Health every month. That number is outrageous.
I actually don't know the answer to that.
I'm pretty sure that's right. It's a huge amount, and even with that, I mean, you can imagine how many women are struggling with these issues. So we definitely need more providers, being able to see these women. Thank you.
Fantastic. Thank you so much, Shannon. And we also, Healthy Lee Behavioral Health Coalition has a subcommittee dedicated to maternal mental health. So for our attendees, if you are interested in being more involved in bringing education and advocacy to our local community to support our moms and moms-to-be, please go to the Healthy Lee website and you can find out a little bit more information on how you can be involved and support the work that Shannon is doing. So we don't have any more questions in the chat. If any of our attendees here in the room today would like to ask any questions, I would definitely open the floor.
Going once, going twice, 3 times. Okay, looks like we're all set. Thank you very much. Very, very informative panel discussion. We will move on to the next group of presenters. Is that right, Lauren? Okay. Okay, so next we have Kim Becker, who's coming to us from Hazelden Betty Ford. Kim?
Good morning, everyone. Thank you for having me here today. Thank you, Lauren, for all your hard work, and all the team, and Paul. Appreciate you all. My name is Kim Becker, and I do represent Hazelden Betty Ford in Naples, Florida, as the outreach manager. And this year we celebrate our 10-year anniversary. But celebrate we're not, except to bring some great programming and offer some no-cost support groups and such, which I'll speak to in just a little bit. We are a 47-bed residential treatment center for primary substance use disorder, and currently we are receiving residential and day treatment with recovery housing, as well as virtual intensive outpatient. During this twindemic, as we're calling it, with the opiate epidemic still looming amidst a pandemic. Our patients range from 18 years and above, and our programming services include 24-hour nursing, first responders group, older adult program, comprehensive services for patients with opiate use disorder, mental health assessments, and groups to include resiliency and DBT. We offer spiritual care services and skill building. And we also offer a large range of recovery management solutions that go well beyond treatment. Most of you might think of us as not taking insurance from our past model, but we are in network with most insurances, and even our virtual outpatient program is covered by insurance. The Hazelden Betty Ford Foundation is recognized by these major insurance providers for our leadership, best practices, research, support, and training in the addiction field. We are proud of our use of evidence-based practices. We're licensed by the Joint Commission, and as a member of the National Association of Addiction Treatment Professionals, NAATP, Hazelden Betty Ford is committed to upholding the profession's highest standards and code of ethics. Our Butler Center for Research studies and advances evidence-based approaches and promising new practices. Our other residential programming across the states in Minnesota for ages 12 to 24 is at Plymouth, Minnesota, and for adults in Center City. Our other residential locations are in California and Oregon, with multiple other outpatient locations across the states. Currently, we have several no-cost programs for family and children, which can be found at recoverygo.org. Recently, we added a 2-day program for children, which I wanted to mention, and that is for those children that are hurt by addiction. And it is a 2-day free program, and these are things we can offer to our community, both in Southwest Florida and beyond, and that can be found at hazeldenbettyford.org/kids. So we encourage you to get the word out on that, along with our free family day program and family support group on Wednesday evenings. If you're interested in learning more, you can always reach me at 239-572-5091, and to make a referral, 855-348-7018, or hope@hazeldenbettyford.org. Thank you, and enjoy your day.
Thank you very much, Kim. And thanks to Hazelden Betty Ford for all that you do. You're a fabulous organization that's been really great to work with for all of us. So thank you. Next, we have Lisa Mann from Park Royal Hospital. Lisa?
Hello, everybody. My name is Lisa Mann. I'm a physician assistant with H&I Healthcare. I also work at Park Royal Hospital with Acadia. So I'm really excited to be here with all of you guys. I recognize a lot of organizations from our discharge data sheets. We've worked with you guys a lot. It's good to see some faces attached to those organizations. So Park Royal Hospital has a lot of services we offer. We treat a lot of different illnesses. With our inpatient care, we have our dual diagnosis. So we work with patients who have a psychiatric diagnosis as well as addiction issues. So we have a 28-day program. If they choose to complete that, they get a certificate at the end, and we work with them throughout the course to make sure we optimize their chance of success. We do medication-assisted therapy if deemed appropriate. Obviously, that's something you want to be very selective with. So we do work with Subutex and Suboxone maintenance therapy. We have our geriatric unit, which there is absolutely no shortage of here in Florida. We have a lot of resources for them. We work very closely with skilled nursing, with ALF, different community resources we refer them to. We have our general inpatient adult psychiatry, so that's our anxiety and depression. We work with those patients. It's issues that a lot of us face, especially now with COVID-19. So we're seeing an influx in that population. We have a women's unit, which is really great because for women who've been through trauma and just feel more comfortable recovering around other women, that's an option for them. We also have our acute psychiatry unit, which is my personal passion. That's our patients who are having hallucinations, our patients who are feeling paranoid or just disoriented. You would not believe how many people who are high functioning, go about their everyday life, have psychotic symptoms like this and are so afraid to talk about it because they think they're going to get a label or it's going to ruin their career. And we work with those patients to help them understand those symptoms. We have our ECT program, which I'm really excited about. ECT is a good option for treatment-resistant depression, but it can actually be used at any stage of depression. I see a lot of patients who have tried a ton of medications and they're just like about to give up, and ECT really turns things around for them. It's a bit scary. I think it's a bit intimidating for people, but we're seeing a lot of good results. So we have information about that on our website if anybody's interested. Let's see, we have our step down to PHP, IOP. So that's where you get a little bit more support, more than you would if you were just seeing an outpatient psychiatrist. You would see our therapists and our psychiatrists more often. You would work with groups on coping skills and just kind of have that additional support if you're going through a rough time in your life. One really cool thing, probably one of the few cool things with COVID, is we were able to establish telemedicine to keep people safer at home. So we can do virtual with a tablet, even a phone. We can do our assessments, our groups, everything that way. So it gives people also the option to be more discreet or private if that is their personal choice. Lastly, the one thing I wanted to talk about with our team, we really like to keep up to date on stuff. So we talk a lot about like, hey, did you see that new article? Have you seen this new research? One of the things we were talking about this week is, I don't know if you guys have heard of fecal transplants, because they're finding that gut bacteria is related to anxiety and depression. I think that's going to be a hard sell. We don't do that yet. I think it's going to go harder than ECT to sell that to Park Royal, but it's really neat. You guys should look into that because we thought that was cool. But yeah, we try and provide the most up-to-date care for our patients. So thank you for having me here.
Thank you very much, Lisa. And thanks to Park Royal for everything you do for our community. Well, folks, you heard it here first, fecal transplants, okay? So hard to know where to go with that. Okay, next we have the pleasure of welcoming Lisa Dean from Elite DNA. Oh, it's not, sorry. Oh, that doesn't have it on. Okay, Dr. Susan Hook from Samaritan House. Yeah. Sorry about that.
Good morning. I'm Dr. Sue Hook, Executive Director and Nurse Practitioner at Samaritan Health and Wellness Center. And what we are, our mission at Samaritan Health and Wellness Center is to provide affordable mental and physical health care to the working, uninsured, and underinsured. So we've been in existence for almost 6 years. We are a nonprofit and charge small fees for service. The integrated primary care behavioral health is a relatively unknown practice. Yeah, we started out that way. So our primary care providers are all nurse practitioners, and we have 2 mental health counselors on board. So we all work together to take care of our patients. As we've noted, some previous speakers were talking about the stigma associated with mental illness and even talking about mental health. The awesome thing about integrating into primary care is that we start from day one when we see our patients. The first thing we do is talk about mental, physical, and spiritual needs. Samaritan Health and Wellness Center is a faith-based practice, Christ-centered care, but everyone is welcome. It's not pushing religion on anybody, but people need to know that we want to care for the whole person, body, mind, and spirit. So our mental health counselors, we have the only clinical certified pastoral counselor in the whole area. His name is Dr. Joel Montalvo. His PhD is actually in pastoral psychology. So he's got his master's degree in mental health counseling and he's clinical pastoral. Our other counselor is Elizabeth Martin, and she is an addiction specialist. So we take care of people from every aspect. We see newborns through elderly. We don't require any form of insurance, and we never turn anyone away. Even if they have a struggle to pay our small fees for service, we try to find creative ways to help them, even if it's a $5 or $10 donation for their fee for service. Our addiction services, which especially now in this time of COVID, we've seen a lot of people relapsing into opiate, especially opiate and alcohol addiction. We do medically assisted therapy, but we only use naltrexone or Vivitrol at this point. We do prescribe about every medication you can think of, but we do not do any kind of pain management for people. Obviously, we're trying to keep people away from opiates and as you all know too, with the opiate addictions, we're also seeing a lot of people with hepatitis C. So with our patients that are Hep C positive that really didn't know they had Hep C, we're also doing treatment for that. We have a lot of people that don't have access to Harvoni or Epclusa, which are the big curative medications right now, but we're getting it for free for patients with no insurance. So that's a big push at Samaritan. In our children's mental health services, we're working on certification for child play therapy, and Dr. Montalvo is actually heading up the child play therapy techniques right now. We'd like to eventually be able to offer our mental health services to children as young as 3. We also do family therapy and marriage counseling. So we're located in downtown Cape Coral. We serve the whole Southwest Florida. Anybody is welcome to come to Samaritan Health and Wellness Center, and we don't require any form of identification as far as residency or proof of income. So everybody's welcome, and currently we have over 8,000 unduplicated patients. If you'd like to learn more about Samaritan, is capesamaritan.com or call us at 239-257-3094. Thank you.
Thank you very much, Doctor, for all that you do. Appreciate. So I gotta get my glasses on because I can't see anything without them. So next we have Nora Donato Hitchcock from Lee County Human and Veteran Services. Thank you.
Good morning. Lee County Human and Veteran Services offer a evidence-based program, MRT, Moral Recognition Therapy, and we do that for youth and veterans. It is an evidence-based program, as I said, and also it's a cognitive behavioral program that leads to higher moral reasoning and assists with making better decision making. It's a great model. Part of it is peer-driven. Currently, what we're doing with the youth is they are gender-specific groups, which tend to work really well. So we have a girls group and a boys group, and both are facilitated and case managed by the same person. So they get to know not just the child we're working with, but also the family as a whole. Those referrals are coming primarily from the juvenile justice system, the state attorney's office for arrested youth. We're trying to divert them out of the court system. We also accept referrals from different agencies throughout the county. Lutheran Services is one primarily that provides us with referrals with kids that are on the cusp of being ungovernable or have already gone over that line and are definitely ungovernable. So currently that's what we're doing, and those are with high school kids. The other group that we run, same type of program, is called Coping with Anger. We primarily keep that group co-ed and probably working with mostly middle school kids to about 9th grade, just simply because they're probably at the same level of maturity. So those are the two groups. In pre-COVID, we actually started MRT, Winning the Invisible War, at the jail. We partnered with Lee County Sheriff's Office Corrections Unit and started going into the jail and doing MRT there. The idea was that once they were released, they would then be released from the jail and start working alongside with the facilitator at Lee County Human and Veteran Services. Also, the referrals would then we would work with Veterans Court to try to get them into the Veterans Court or any of the other specialty courts that they are. Unfortunately, March 15th was the last day that we were able to be at the jail, and so we are just waiting until everything kind of opens back up so that we can restart that group. But that was just veterans regardless of their discharge. So we were really happy that we were able to do that there. Aside from that, Lee County provides a little over $4 million to Salas Care for their adult and youth behavioral programs. Currently, we're in the process of creating HOT, which is Housing Outreach Treatment. Isn't that great? We're always into acronyms, right? HOT, Housing Outreach Treatment Team, with local law enforcement along with Centerstone to provide the clinical services that are needed out there for those people experiencing homelessness. And aside from that, we want to make sure that regardless of what is going out there, that people know that we are a resource and we are able to provide either a referral or actual services directly from our office. If you have a youth or if there's youth that really need to get back into line, that MRT is a very structured program, and all you would need to do is contact Lake County Human and Veteran Services and just ask for youth services. Otherwise, our referrals are coming from the arrested youth. As far as veterans, as I said before, regardless of their discharge, we will work with veterans that, to keep them out of the criminal justice system and or alongside the Veterans Court Administration. Thank you.
Nora, thank you very much for the presentation and for all that you do. A great array of services. Next, we have Hillary Carney from Hope Clubhouse.
Good morning. My name is Hillary Carney. I'm one of our business unit coordinators at Hope Clubhouse of Southwest Florida, which means that I work alongside adults with severe mental illness in the daily work of running a mental health nonprofit that creates a safe and welcoming environment for those same adults. Hope Clubhouse of Southwest Florida is a community of support for individuals with mental illness that provides access to meaningful work, both in volunteering at the clubhouse and in support with paid employment, as well as offering opportunities for housing, education, and wellness. We're celebrating 10 years this year, and in those 10 years, we've been able to support over 600 individuals and their families. Hope Clubhouse is part of the Clubhouse model, which is a SAMHSA recognized model of mental health recovery that has been shown to reduce inpatient access, use of inpatient or incarceration or other acute services. It's meant to go along with clinical support services. I recognize a lot of people that are referral services out here right now. Thank you all. And the two main parts of our model are relationships and recovery through work. So people who come into the clubhouse to access what it has to offer are not seen as clients meant to be served, but as members working together with other members coming in and working together with paid staff. That's one of the unique things about clubhouse services, is that members and staff collaborate to decide what projects are important for the clubhouse, what work needs to get done each day in running the clubhouse. Members decide their level of engagement and the specific tasks that they're interested in working on. And that is where the recovery through work part comes in. So members work with they decide on what activities that run the nonprofit play to their strengths, or what things that they would want to learn, what challenges that they have that the volunteer opportunities help them work on overcoming. And it's, again, it is strengths-based rather than a clinical environment. It is a good place to work on any skills that they may have learned in clinical environments, which has been very helpful for a lot of people coming in, for instance, out of Park Royal's outpatient programs. It's kind of it can be kind of a next step for many of those members in that environment. So the actual work involved for members is they have the opportunity to work in our business unit, which does office work, works on customer service, outreach, both among clubhouse members and in the community, working in our kitchen where we provide share of cost meals to all of our members, working in our garden in our 2 locations, on our main location in Broadway and Fort Myers, and in Cape Coral by the city, and the community garden by City Hall. And members work at, again, all levels of clubhouse work. For instance, our social media outreach is led by a member. We had a member develop a home visit program during this COVID-19 situation. We have members who make a lot of the decisions about what we choose to grow in our garden programs. And we even include members in the hiring of staff as part of that. Outside the work order day, we also offer different levels of support for employment. Out of 270 members that came in 2019, over 100 of those members were employed through the clubhouse in one situation or another, making almost $600,000 of income that year. We offer supports ranging from transitional employment, where the clubhouse offers training for members on the job. Some of our employment partners are actually here today right now. And all the way up to support with interviews, resumes, to being able to be there as an opportunity for members who are working full-time, but still having that community available. We also offer support with education, including assistance with applications, with grants through Fountain House, the New York City Clubhouse, with their scholarship program, working on a wellness program involving healthy eating, support with smoking cessation, building emotional wellness, and also assistance with and referrals to housing and community resources. With COVID, we've also been able to actually expand the services that we offer. We offer about 25 hours a week of Zoom programming that is often led by members, and topics are chosen by members. We plan to maintain the Zoom programming after reopening, because we've seen that it does not only help members who are quarantining due to COVID, but who leave the area or are feeling well enough to engage with the clubhouse, but not to take the bus route, etc. So we plan to still continue both these programs for both current and future members. To get involved with Hope Clubhouse, we would need a referral from a mental health provider. We have a referral on our website at www.hopeclubhouse.org. And so a referral and some recent clinical information, because our services are available to all adults with mental illness, but we do want to have a basic assessment so we can know where a potential member is at. We also, if you have questions, you can contact us at 239-267-1777, and we'll be happy to hear from you. Thank you all.
Thank you very much, Hillary. I think we'd all agree that Hope Clubhouse is a real gem in the community, and can't say enough about all the great work they do. Speaking of another gem, we have Amy Strom from Valerie's House, who's going to come and talk about what they're doing over there.
Thank you all for having this great opportunity for all of us to share all of these great services in our community, so we can all come together and help serve everyone who needs assistance. So for those of you who don't know, I'm Amy Strom, and I'm the Director of Programs and Bereavement at Valerie's House. And Valerie's House is such a special place in Southwest Florida, where children get to come together and connect and learn that love, and after the death of a loved one, that they can heal, that they can connect with other children, and that they can work through this together. Valerie's House was founded almost 5 years ago. We're coming on our 5th year anniversary soon, by our founder, Angela Melvin, whose mother, Valerie, died right here in Fort Myers when Angela was 10. Angela did not really have a place to go and talk about grief, talk about what it was like to grow up without a mom. And as she got older, realized that that really did have an impact on her life in different ways. And so it's so important that we're here to be able to help kids learn to express their feelings and express how that loss and how that grief affects their life, affects their relationships with others, and continues to do that as they grow. So our mission is really to help children and families work through the loss of a loved one together, and to go on and live fulfilling lives, that this loss, the death of their parent or sibling, doesn't have to limit their dreams. They still can have such a fulfilling life. It might be a different path that they might go through, or they might have to go through different channels to get there, but that really we can all be successful. And really, our whole goal is that no child grieves alone. We really want children to know that they're not alone. Angela grew up thinking that she might be the only one who didn't have a mom, and so she didn't talk about it. And it's so important, especially with our statistics. And thanks to the child bereavement estimation model, we know that 1 in 13 children will experience the death of a parent or a sibling by the time they're 18. If we look at by the time they're 25, that number goes to 1 in 8. So we know that this is such a critical phenomenon in our world, and we need to start normalizing this for our children and our society. So we are so lucky to be a nonprofit service so that everything we do for our families is free. We specialize in peer support groups. Families come to us twice a month to get services. We know that for our children, sometimes finding the words to express what they're feeling is so difficult. So we develop a curriculum ourselves that works a lot and relies on expressive activities that can help children begin to heal and begin to talk about it. They begin to identify and express their feelings. They begin to develop appropriate coping skills and healthy coping skills. They begin to continue and create continuing bonds with their loved one who has died. And also through that, develop resiliency and a hope for their future. It's so important that we do that. So we have 3 sites in Fort Myers, Naples, and Punta Gorda, where we're able to serve so many families. Last year we had 609 individuals walk through our door, and that's even increasing as we see this year. We work with our families and have separate groups. So although we have 10 group nights, on any group night when you would come into our house, you would see that there are 4 or 5 separate groups going on. We divide our kids into age appropriate groups so that they can connect with kids who are their peers and also who have some similarities, and they can rely on each other to develop skills and develop resiliency and develop hope. We also work specifically with our caregivers so that they have the tools they need to also not only help them grieve, but also to help raise their children who are grieving and develop the appropriate coping skills that they need to help support them as they go through life grieving. We do have special groups, not only just some who are for widows, but we do have Life Without Moms, which is a support group for dads who are raising children alone. We have a group for grandparents raising grandchildren. We have a sibling loss group. We have Spanish speaking groups and also young adult groups. We have also recently started offering individual counseling to our families. We realize that counseling services, especially related to grief, is very unique, and there aren't a lot of providers in our community who do that. And we want to make sure that our families get the best support that they can. And so again, the service is free to our families who come. And it just offers for some of our families whose maybe the death may have been a little bit more traumatic or may not want to be or feel comfortable yet in a group setting, they can get that individualized attention and still work through their grief process. We've also begun a mentor program. And so the mentor program, we know that because of the loss of a parent or a sibling, some of our children may not have that positive role model that they used to have in their life. And so, but we know, research shows that if children have one positive adult role model in their life, that they will become more resilient and have a better success at achieving goals and not having adverse childhood effects affect their life later on. And so by bringing in mentors for our children, we're hoping that we can make some of these connections for them. So if anyone wants to get involved, please don't hesitate to call 204-5804, or you can look at our website, Valerie's House, swfl.org. Thank you so much.
Thanks very much, Amy. Thanks for all the great work you're doing over there. Next, we have Lynn Thorpe from the Alvin A. Dubin Alzheimer's Resource Center. Lynn?
Good morning. My name is Lynn Thorpe. I am the Executive Director of the Alvin A. Dubin Alzheimer's Resource Center. We are located in Fort Myers, just 5 minutes from here on the corner of College and Summerlin. And we are a United Way agency. We're a nonprofit agency providing all of our services for free. So I wanted to start with some facts. I'm shifting a little to the senior population. 10% of the United States population over 65 is diagnosed with Alzheimer's or a dementia-related disorder. In Florida today, that equates to about 500,000 people in over 65 in Florida, and that number is expected to grow by 25% in the next 4 years. So if you think about that, for every individual, they have a caretaker. The caretaker can be their spouse, their neighbor, their friend, a community member. Just depends if the individual is actually living at home and even has somebody there. So what does the caretaker do? The caretaker has to do everything from navigate the system. They're brand new to this, arrange transportation, help with feeding, medication reminders, bathing, toileting. It can be pretty daunting. So that's where we come in. People can call our center. We offer a variety of services to individuals and their caretakers. So we have support groups. We have support groups for early onset individuals experiencing dementia. We have support groups for adult children and for their caretakers. We have about 17 different support groups. They've all gone virtual right now, which is also adding, as you can imagine, some complexities working with people who technology and Zoom technology is new to them, but we are helping them through the processes of learning how to Zoom. We also offer memory screening. That is a service we're doing right now in person by appointment with safety precautions in mind. And we refer those individuals for further assessment and evaluation to a free local organization. We have a lending library in the back, along with some rooms for people to come in and relax and talk to each other. We've got all kinds of books available for checkout and resources on all different home health agencies and community organizations and long-term facilities. And we also help people enroll in safety programs. So we know that 8 out of 10 individuals with Alzheimer's tend to wander. And this is a huge concern for caretakers. So we have 2 different programs that we help people with. One is where we enroll them where they get a bracelet. And the bracelet is not only for the individual, it's for the caretaker. So in the case that the caretaker is in an emergency and ends up in the emergency room or something, they'll see that bracelet and they'll call the police department to go to the home to make sure that the individual with Alzheimer's at home is safely cared for. The other program we're working with United Way and the Lee County Sheriff's Office is the Reunite program, where they go to the home and they swab the person's underarm to have a scent. The scent is then kept in the refrigerator, and if the person has ever gone missing, the sheriff's office goes into the home, they bring their bloodhounds, and they are having huge, wonderful results with getting these people back home safely. This is also for any of you serving children with like autism. That's a great program to get them enrolled in as well. We also offer respite. I can't say how important respite is. It's something that is not reimbursed by insurance. And so there are so many families out there who can't afford it. So we are working with local agencies to get grants to be able to get these people help in their home. If you can imagine now, people are feeling even more isolated. They're in their home trying to take care of their loved ones. We're trying to help them even get respite for while they're joining the support group, because it's really hard for them to focus in on a Zoom when they're concerned about their loved one either being in the home and being safe or feeling uncomfortable talking about their loved one who's next to them, and trying to understand how they're feeling and work with others. We have educational trainings that we provide for free to our community partners, to healthcare workers, to first responders, so they know how to approach people with dementia and how to redirect them, manage difficult behaviors, etc. So if you have any questions or you need help, please call our office. It's 239-437-3007. Thank you.
Thanks very much, Lynn. Sounds like you're doing great work over there. Okay, that brings us to the end of our second slate of presenters. Lauren tells me that we have some questions teed up already, so I'll let Megan begin to raise those.
Thank you to our presenters. We have quite a few questions rolling in. The first being for Hazelden Betty Ford. relapse was on the rise during COVID in the recovery community. What was Hazelden doing to support their alumni during that time?
Our alumni support is really strong. I did speak to one of our coordinators, and even though they couldn't meet on site, they had a strong virtual program. We have many that still attend when we could in person from all over that come in to do annual meetings and such. So even those were supporting some of the new alumni that were dealing with, not only a pandemic, but then new to being in recovery. So we ramped up, all of our virtual, just as we did within our campus for outpatient with the alumni services.
Great, thank you. We don't hear too much about that end of it, the continued recovery during COVID. With the shutdown of a lot of 12-step meetings and support groups, we know that Hazelden was one of the treatment centers that offered a lot of layered in alumni support and access to services, so thank you. The next question would be for Valerie's house. Ms. Amy Strom, how would you say that COVID, given the new restrictions such as visitation, the funerals were difficult to have, how has that affected grief and loss for individuals that have suffered a loss during this time?
Yeah, it's been quite impactful for so many people in so many different ways. I mean, the way that we as a nation celebrate or used to do funerals were to join together to support each other. And that's been very limited during COVID, obviously. So for many families, they have been forced to do that on their own or postpone that. And for all of our families also, which people aren't really thinking about as well, they just began, who had a loss maybe prior to COVID as well, maybe just began to adjust to some of their new normals. We're also seeing an increase in their in other complications. Now they have to readjust to a new normal now again after COVID and those restrictions. So it's been very difficult for many of our families. Not only are they grieving the loss of a loved one, but also grieving the loss of the world and the experiences that they once had. So again, ramping up, working with our families both virtually and in person. Now we have begun to come back in person in August, but we offer both supports, and that's really why individual came out as well. We realized that there were more difficulties with our families' experiences, and then also the secondary losses that also accompany grief that we don't talk a lot about, loss of income, which for some of our families already had one. And now with COVID also then experienced another loss of income or could have had another setback. So these families and these children have had multiple setbacks. And so just continuing to help them keep on a path, knowing that they're not alone, knowing that their feelings that they're experiencing are so normal, and that it's okay to sometimes feel down and feel discouraged and feel angry at what's happening to them and feel as if it's not fair, and then being able to develop coping skills to cope with that and then look forward at what some of those positives might be. Oftentimes we look at the negative, but also to help them think about what their positives are and looking and moving forward.
Thank you, Amy. And what adult services does Valerie's House provide at this time?
Okay, so we provide support for the caregivers of the children who come. When the children come to participate in their peer supports, we also encourage their caregivers, and we call them caregivers because it's a variety of different people who actually wind up taking care of the children who we serve. And we provide them the support as well. Some of them are grieving themselves and they need the tools to help them understand why some of their children may be seeming to have minimal reactions to the grief and may internalize some of those behaviors, and some of them externalize those behaviors. But that everyone's affected, and although we know everyone grieves differently, in our profession and in our world, it's nice for the families to know that as well and to understand what signs to look for, and then even to begin how to begin to set boundaries. It's so important, again, to keep boundaries in place for families and set those consistencies, because those are things that keep our children safe, knowing that there are rules and limits and guides to help them go through life. So helping our parents as they're struggling also through grief, to be present in their child's life and to help support them too. Some of our adults also receive individual counseling too, to help them with those issues as well.
Great, thank you so much. Our next question is for Lee County Human and Veteran Services. How is the veteran population getting through the pandemic?
We mainly are working with those few that are able to actually get out. However, it is very difficult simply because, like everyone else, their whole world was changed. And also the population of veterans that I have worked with through that Winning the Invisible War program are veterans from either the Vietnam War who are up in age already and have all these new responsibilities that they or requirements from the court system and are very difficult to get through. And with the pandemic and everyone going to a Zoom conference or to a video conferencing, it's very difficult for them. So they almost gotten to the point where they're given up and just waiting for it to pass and then start all over anew, even though they set back. So also working with some of the veterans that are from the Iraqi and Desert Storm, they're a little bit more able to adapt to this new way of doing things because they are younger, and also they have children that they've had to keep up with the technology. But for the most part, they really do. I almost think that it's like a craving to be in person rather than try to get all their treatment virtually. I know the very first time we opened the door and we sat in a group, it was more of a social gathering. I don't think we addressed one step that night, but it was more of a social gathering. Even though we had met virtually a few times, it was almost all over again because they were craving that type of an environment.
Thank you so much. Our next question is for Samaritan Health. Can you share a little bit more about what play therapy looks like and what age group that is most typically recommended for?
Play therapy is obviously children usually under the age of 7 struggle to verbalize their thoughts and feelings to a counselor. So play therapy is centered around actually playing. The child is able to play in an environment with toys, with little setups like a kitchen, miniature living room, to actually have the therapist play with them and watch them and then relate their lived out realities so the therapist can get an idea of the child's feelings. We actually are working with our friends from Valerie's house, and they're helping us develop our child play therapy program. Currently, Dr. Montalvo, the director of our counseling services, works with children as young as 7. And even with those children, he works a lot with play and coloring and those kind of things. But once we're able to get our play therapy room up and running, we'll be able to address, like I said, children as young as age 3. And we're seeing a lot more families that are bringing their children in just because, especially during COVID and the isolation that everybody is having, and then with the drug and alcohol addiction, we're just really seeing an explosion of children needing mental health services.
Great. So thanks very much to all of our second slate of presenters, and for those of you who put your questions in the chat box. Right now, what we're going to do is to take about a 5-minute break so that people can get up and kind of stretch and wander around, go to the restroom if need be. During that time, we're going to play a Kids Minds Matter video that I think those of you will, who know something about Kids Minds Matter will enjoy. So we'll take a break.
My daughter was an honor student and an athlete, but she experienced a traumatic event that led to anxiety and depression. In her words, she was spiraling out of control, but there was no place for her to go as a minor. So we had to wait until she turned 18 to get the kind of specialized care she needed for PTSD.
That was me. It was really difficult. I felt like I was hanging on by a thread. We must acknowledge that childhood trauma is an epidemic in our country, but there aren't enough resources to treat it.
While we've made great strides, there's still a 3 to 4 month waiting list to see a pediatric provider in Southwest Florida. So we're not there yet. Adding more qualified providers is critical.
Having a child of our own who struggles significantly, we know how important the providers are. And we founded Kids Minds Matter to help create more awareness and support for children's mental health in Southwest Florida.
My daughter tried to take her own life. I knew there was a problem, and I was frustrated that we couldn't get the help she needed. It was like a slow-moving freight train that was coming. I could see it, but I couldn't stop it.
That was me.
We have processes and procedures in place to help students whenever the need arises. But most important thing is cultivating supportive relationships with our students.
After overdosing, my daughter went to the school nurse and told her what she had done. Having someone at school who she felt safe talking to probably saved her life.
We're thrilled Kids Minds Matter is helping to provide Lee Health navigators embedded in the schools. And if they can proactively help kids and families with complex mental health needs find solutions more easily, it's a win for everyone.
I've been a mental health provider, and I've been on the other side of the table as a parent of a child with severe needs. So I know how hard it is for a parent or caregiver to rise to the challenge and be an advocate for their child.
That was me. I'll admit it. I didn't want to take a parenting class. I didn't think I needed to. I'd raised my own children and know I did a good job. But once I got to the Kids Minds Matter class, I felt like I was in a college level course, and it really made me do some soul searching. It changed my whole approach to raising my grandson and my nephew. And I like to think Richard helped me go from good to great.
With community support, Kids Minds Matter provides parenting classes and support groups that give caregivers the tools and support they need to be their child's advocate.
I struggled with an eating disorder in 7th grade, which inspired me to create the Normal is Overrated program during my junior year of high school. It helps kids like me share their stories so other kids can feel less alone and learn about resources that can help. I couldn't have done it without Kids Minds Matter.
Because of the support that Kids Minds Matter provides, platforms like those given to Carly empower young people to take ownership of their mental health and seek help for their challenges.
Which is why we ask you
to send a strong message, loud and clear,
to the children of Southwest Florida,
that we're in this together.
Kids Minds Matter.
Okay, we're going to get started again. This is our third and last group of presenters, and I'm delighted to introduce to you Dr. Laura Baltodano from Andrews Anthem.
Good morning. My name is Dr. Laura Baltodano with Andrews Anthem. Andrews Anthem is a 501c3 nonprofit organization that focuses on promoting and building a strong foundation of well-being in 10 to 24-year-olds and their families. Andrew is my son, and the organization was founded after he passed by suicide in 2018. And I knew at that time, while my world was completely shattered, and there was nothing I could do to change what was, I felt very strongly that I had to make a difference and take action to make a difference in what was going to happen next. And so our organization focuses on promoting different programs that focus on mental wellness through the promotion of mindfulness-based programs. And we focus on teaching present moment awareness and self-compassion. So all of our programs have that as a foundation and a core, but we kind of do that in different locations, and it's offered in different ways. So one of our programs is called Positive Pause. We work with animals in that location, as well as talk about mindfulness and self-compassion. And that's provided at the Gulf Coast Humane Society, and it's also given and promoted at ARC, the Animal Refuge Center. In response to COVID, we started a program called Let's Get Groovy, which was kind of like our Positive Pause, but without the animals, and we do that online once a week. We also have a Positive Yoga, which is a puppy and kitten yoga, which is a lot of fun. But we haven't provided that since COVID, but it's something that we look forward to doing as soon as we can. We have a program called Revive, which is a 10-week mindfulness-based program that is founded on a course called Awakening Joy. Right now, that program is offered online because we can't meet in person. But we were very fortunate and hope to do it again over at Valerie's house once we kind of are back to normal, if you will. We're also an FGCU learning agency, so we work a lot with college students that have an interest in mental health. And as they go through our program, namely Revive, then they help to support our programs by helping facilitate and lead some of our programs, which in fact one of them is tomorrow. So a plug there too. We have our very first mental health hike, which we're really, really excited about, in collaboration with Crew Land and Trust over at the Crew Marsh Trails, really to promote the World Mental Health Day. And we're really excited about that. We really feel strongly that getting back to nature is a big part of promoting mental wellness. We're also going to be bringing in a program that's mindful self-compassion. An offshoot of it is called Making Friends with Yourself, which is more targeted toward teens. And we'll be offering that starting next year. And I'm really excited because we're about to start a program over in collaboration with the YMCA. That's an intuitive art, abstract art, so you don't have to be an artist to attend. And that's going to be offered once a month, starting this month until at least December. So those are all of our programs. We feel really, really strongly about creating a community and connection with teens who oftentimes already feel very disconnected in many ways, now more than ever, and fostering resilience through our programs. Understanding that life is hard sometimes, and that's just the nature of things, but that once we have the tools to navigate that we can still live a joyful life, and we don't have to do it alone. So, thank you.
Thank you, Dr. Boltodano. Really great stuff going on.
Thank you. And I should add, our website, sorry,
that's all right,
is andrewsanthem.org. We have a live chat on there. We also have a way to contact us. And then our phone number is 239-645-2309. Thank you.
Fabulous. Thank you. Next, we have Lorena Rodriguez from the Golisano Children's Hospital. Lorena?
Good morning, everyone. I'm Lorena Rodriguez. I'm the Child Advocacy Program Coordinator for Kids Minds Matter at Golisano. Our Kids Minds Matter initiative at Golisano is to identify and fill in gaps in the system of care. In Kids Minds Matter and Child Advocacy, what we do is we have a public education program that provides awareness, prevention, education, and early intervention. And we also have a mental health navigation program, which is intervention at the highest end, while providing intensive care coordination and using a peer-to-peer model. And we will discuss the mental health navigation program in more detail later today. Our Kids Minds Matter public education programming provides learning opportunities for not only caregivers, but agencies in the community. We offer a number of classes and trainings, workshops, and support groups. Some of the classes that we offer are mental health first aid in both the adult, youth, and higher ed modules. We do offer a parenting class for parents of exceptional children with unique needs, including mental and behavioral issues. We were providing these classes at the Lee and Collier County Jail prior to COVID. We hope we can get back in there soon, as we saw lots of great things come from that as well. We provide parent workshops on effective and positive discipline, as well as understanding special education. We also collaborate with the Children's Advocacy Center in Collier County and provide parenting classes in the community there. For our local agencies, we have mental health awareness presentations as well as trauma-informed care. We are able to offer all of these in Spanish. All of our programs are free thanks to Kids Minds Matter. Because of COVID, we have transitioned to virtual as well, so everything is up and running virtually. When we can resume to face-to-face, we are able to provide childcare and some refreshments when we have our parenting classes and support groups. As far as our mental health navigation program, we have mental health navigators embedded with the school systems in Lee and Collier County. It's providing wraparound services, and we have now 3 navigators in Collier County and 2 in Lee, and we will be discussing that later on today. To find out more about our classes or to see when we are offering them, you can go to leehealth.org/classes, or you can call me at 239-343-5803. Thank you.
Thanks, Lorena. Another shameless plug. Lorena and Richard Keelan, who many of you know, do some amazingly important work in the community. And you're going to hear a little bit more about our care navigation program, which we're really excited about. But I just want to say thank you for all the good work you're doing. Okay, next we have Adina Bridges from Centerstone. Adina?
Hello, everyone, and thank you for having us. My name is Adina Bridges, and I am from Centerstone. We were lucky enough to migrate here south about 2 years ago in 2018. Since coming here, we have developed 6 programs. We have 2 FACT teams. These work for individuals suffering from severe and persistent mental illness. They're community-based, so our psychiatrists, therapists, substance abuse specialists, peer support advocates all go to the client's home and provide those services. This is a referral-based program. We also have the CAT program. This serves individuals, well, children ages 5 to 21 with behavioral health difficulties. It's typically used as a diversion or a step down from SIP placement or a diversion from any sort of out-of-home placement that may occur. Children receive the same services as a FACT team. So we have a larger team that goes to the clients. We provide support for family, foster parents, the school. We go into the school, into the home, and into the community. Really, it's whatever the client and family needs. So we're spread in a lot of different directions, but it's that all-inclusive care that is important to get them doing better in the community. We also have the mental health court and veterans court programs now. This is obviously to provide some therapeutic services to individuals with criminal justice involvement. We provide therapy and case management, and it's in conjunction with multiple community providers to really get them the services that they need, depending on the problems that have come across. We also have our AOT program. This is assisted outpatient treatment. It is actually involuntary outpatient treatment. This will be a collaboration with Salus Care, Park Royal. They'll be very important in getting this program running. Referrals will come from the crisis unit. It works with the civil commitment hearing. It will be involuntary outpatient treatment. They will receive regular updates and meetings with the judge just to kind of enforce that continued treatment. But there is no punishment, although it sounds involuntary. That's typically how we associate things. That is absolutely not the case. We're just trying to encourage continued treatment and assistance from the community. In Manatee County, we do have our addictions unit and our crisis center. This serves both adults and children, so we do utilize that as needed for individuals in the community. Centerstone is actually in 5 different states, so we're rather large, but we just moved here, so I'm super happy to be here. We couldn't do it without everybody in this room, and I think I call everyone that's been speaking on a regular basis. So thank you so much. Don't stop from reaching out. Thank you.
Thank you, Adina. Thanks a lot. Thanks for all your good work. Next, we have JP Mojica from the Center for Progress and Excellence. JP?
Hi, I'm JP Mojica. Thank you guys so much for allowing me to speak today. I'm the executive director at the Center for Progress and Excellence. We are a local non-for-profit serving the 5 counties, Charlotte, Lee, Collier, Hendry, and Glades. We have 3 government contracts. The first one is a federal contract. It's through Trafficking Victims Assistance Program. It is to serve foreign-born clients identified at the border who have been trafficked. Unfortunately, it's not domestic. They have to be identified at the border, and it's a federal contract. We provide case management to those clients. It's a 12-month program. We provide financial assistance for housing, for legal status, citizenship status, residency status, education, clothing, whatever that client needs, because this will be the first time they are entering the U.S. They've been, like I said, they've been identified as being trafficked elsewhere from the U.S. It's a 12-month program, and we provide, like I said, financial assistance. Our second program is the Department of Juvenile Justice, serving kids between the ages of 12 to 19. The referral sources come from the juvenile probation officers. Dependent on the crime committed by the client, if it's a violent crime or if the child is stating that they need some mental health resources, the DJJ makes a referral over to CPE, and we provide a 16-week outpatient counseling. We see the clients at homes, at schools, sometimes in the jail if they violated probation, once a week for 16 weeks, just to kind of lower recidivism and allow them to process kind of how they got into the system. Now, our major contract is the Mobile Crisis Response Team. It is completely funded through the Central Florida Behavioral Health Network. It is a 24/7, 365 crisis hotline. As we all know, this crisis cannot be scheduled. So I have a master's level clinician who answers the phone at any time. That is our dispatch. Basically, if a call comes in, we have 3 different levels of a phone call. We have the routine phone call, which is someone who's not having any active suicidal ideation or doesn't even have any suicidal ideation. They're just looking for resources. Someone who might have lost their job due to the pandemic. Someone who might be having problems with their girlfriend or their parents, just looking for some resources. Then we have our urgent calls. Our urgent calls are someone with passive thoughts who might have had some self-harming behaviors in the past. And then we have our emergent calls, someone who is actively suicidal, someone who has, has had previous attempts. They might not have a plan, but they have indicated to somebody that they're having active suicidal thoughts or ideations. So what happens is when we get a phone call, we dispatch out to the location. We send a master's level clinician who does the suicide assessment. It's called a SAFE-T. It is ACA based. That is scores based upon how the client answers. It scores it from severe all the way down to minimum. When the master's level is speaking to the client, once we arrive on scene, the master's level is tasked to utilize motivational interviewing skills, crisis intervention, de-escalation techniques, as well as a suicide assessment. Now, while the master's level is doing this with the client, the bachelor's level is talking to the people in the home, in the schools, in the hospital, kind of getting a background of how did the client get to this crisis. Because sometimes when the client is in crisis, they can get kind of tunnel vision. They don't know exactly how they got there, but they know that they are feeling an abundance of this emotion. So the bachelor's level is kind of doing a psychosocial with the community or the family members, seeing if has there been any previous bake racks, involuntary placements into the CSU. Have they ever had any treatment, any family history of mental illness? That kind of thing that will kind of give us a clearer picture of how the client got to this crisis moment. And then once the master's level is done completing their suicide assessment, we have licensed mental health professionals that are on the clock 24/7 as well. The licensed mental health professional is completely through telehealth. We utilize a HIPAA compliant software that's called Doxy, where the master's level will call the licensed professional on Doxy, giving them the scoring of the safety as well as kind of what's going on in the situation. It is then up to that licensed professional that if they want to speak with that client by them and do their own assessment or take the master's level clinicians by the word. Now, if it's a high or severe risk of suicide, they are to do a telehealth assessment with that client individually. If the client is still having active suicidal or homicidal thoughts, that licensed professional will will initiate the Baker Act, the involuntary placement. That licensed professional will send that Baker Act form to the master's level on shift, who then will contact law enforcement. Unfortunately, due to liability and insurance purposes, we are not able to transport. We lean on law enforcement to do all of our transportations to the CSUs. But all the paperwork will be done. The licensed professional will send it over to the master's level, and then law enforcement will transport to whatever available CSU is in that location. Essentially speaking, the thought process behind mobile crisis is the local law enforcement and NAMI do a great job doing crisis intervention. They absolutely do. The uncomfortable truth is that just sometimes when law enforcement shows up, that uniform can just make a client have more of an anxiety or anger or an emotion. Local law enforcement do a great job. They absolutely do. Just that uniform can cause the fight or flight kind of emotion that comes with that. So we send mental health professionals out to do the mental health assessments. No matter if a client gets placed on the Baker Act or if they do not, we provide wraparound services in regards to a peer specialist, a mentor, who will do face-to-face with that client once a week for 30 to 45 days. As well as that peer specialist, we provide a case manager who will be involved for 120 days. The case manager is tasked to give a needs assessment to that client or that family to determine what kind of daily living that they might be deficient in, and then they will make that service linkage to the community. We lean on Centerstone a lot, Salis Care, Elite DNA, Charlotte Behavioral, David Lawrence. We lean a lot, Hope Clubhouse. We do a lot of referrals to the local organizations just to ensure that this client is safe. I'm a firm believer of it does take a village. That's so cliche, I'm sorry about that. But so all of our services are completely free. It is completely funded through the Central Florida Behavioral Health Network. And the client also does not have to call themselves. We've gotten multiple phone calls from, because everything has transitioned to telehealth, a clinician who, it could have got hairy during the session saying, hey, this client is having suicidal thoughts. We will dispatch out. Our only caveat is suicide is not a game. When we knock on that door, we're going to say, Dr. Simeone let us know that you're having some suicidal thoughts. Can we sit down? Can we talk and see, kind of assess what's going on? We're always going to indicate who made that referral because we want to establish that trust with that client on an initial visit, as soon as we knock on that door. There is no age limit to our services. We go all the way from infant all the way to the geriatric population. So if you have any questions, the abuse hotline is 844, I should know this, 844-395-4432. Also, we are in the office. Our office number is 239-689-8490. And our website is www.progressandexcellence.com. Thank you guys, and have a good day.
Thank you very much, JP. Much appreciated. We all lean on CPE quite a lot, so thanks for all the good work you're doing. Next, we have Lisa Dean, finally. My apologies, from Elite DNA.
Good morning. My name is Lisa Dean with Elite DNA Therapy Services. I am the Director of Business Development. Yes, I have just joined Elite DNA approximately 3 months ago. Elite DNA Therapy, I think a lot of questions, people will ask me what DNA stands for. So Elite DNA is owned by Elizabeth Doseretz, who is our CEO and founder, and her husband, Jason Moon. When she first started this program, she had suffered from postpartum depression and not having access to services for her children as well. So she named this company, DNA stands for the initials of her children, Dylan, Nathan, and Ashton. So it has been running strong for 5 years. We now have approximately 8 locations. Let's see, we are for profit, but we act with the mentality of a nonprofit organization. We are overseen by our medical director, Dr. Omar Ricci, and Dr. Sharon Bloom. We have over 200 employees across all of our 8 locations, consuming of psychiatrists, psychologists, psychiatric nurse practitioners, physician assistants, case managers, care managers, medical assistants, and interns. We provide services, children 3 years and up. We currently are in Fort Myers, which is our main office. And then we have a Naples location, Lehigh, Cape Coral, Port Charlotte, Venice, Brandon, and Waxahachie, which is over on the East Coast, with several more offices coming to open up within the next few months. Let's see, I think. So at this time, I'm trying to think, we accept all insurance companies. We also have a sliding scale for patients who finances might be a barrier. We don't want that to be a barrier. So we are very happy to always work with our patients, and we will never turn them away. Let's see. I think that's really a high overview of what services we provide. So psychiatric mental health, speech and occupational therapy. We also have TMS, as well as our Spravato clinic. Those services are for patients who suffer severe depression and maybe are treatment resistant. We can be contacted at 239-223-2751. We also have an email, info@elitednatherapy.com, as well as our social media platforms. And we actually, at this time, all offices are open 8 to 5. We have virtual access as well. That runs 8 in the morning to 8 p.m., Monday through Friday, and then Saturday and Sunday, 10 to 2. And if we also partner with NAMI Lee, NAMI Collier, Hope Clubhouse as well, and we are now working with the Public Defender's Office just to help some of our and maybe the inmates that are getting out looking for services, we are working with them. I can be contacted at 239-216-1110. And if you have any questions, I will welcome those.
Thanks very much, Lisa.
Thank you.
Thanks very much. And thanks to Elite DNA for all the good work they're doing in the community. Next, we have Quentin Clausen from the Children's Advocacy Center.
Good morning.
Good morning.
Can you all hear me? I don't have like an audio thing. So my name is Quentin. I'm a clinical therapist with Children's Advocacy Center of Southwest Florida. If you're not familiar with what we do, our mission is to provide a coordinated response to child abuse and neglect. So part of that, big part of that, is our Family Alliance program, which is our therapeutic program, program I work on. And we provide free therapy services to children ages 3 to 17 who have experienced some form of abuse, physical abuse, sexual abuse, neglect, family violence. Even if there are allegations or it is just believed that the child could have experienced something, we can offer services to them. With that, more specifically, we offer individual therapy, group therapy, and then family therapy to children ages 7 to 17. And then for the younger kids, ages 3 to 6, we offer what we call our COPE program, which is all psychoeducation and prevention. With that, we also have animal therapy. We have dogs that come in quite frequently and can work with the kids. We use some animal-based interventions. A big part of that, though, is just to make the kids feel comfortable. We are a child-friendly outpatient setting, and so everything really revolves around that. Anybody who's familiar with abuse, trauma, especially a typical child's response to abuse or trauma, knows that a lot of treatment centers around comfort. So we try to make sure that that happens. Yeah, so you can reach our phone number at 239-939-2808. We also have our website, which is cac-swfl.org. And that's it. Thank you.
Thank you, Quentin. Thanks very much for all the good work you're doing in the community as well. So the last presentation of the day is actually not going to be by a person, but by video. And this is from the Coalition for Drug-Free Southwest Florida, excuse me. Deb Camella could not be here. Everybody knows Deb. She had apparently she had a better offer, let's put it that way. So she's going to play, we're actually going to play the Drug House Odyssey video, which some of you may have seen. It's really quite excellent. So we'll go to that now.
I'm Sheriff Carmine Marcino. It is my pleasure to introduce you to Drug House Odyssey. An odyssey is a journey, and this journey shows how important it is to make good choices, especially about drugs and alcohol. What we see on our odyssey today happens every day in towns and cities across America to real people. You will see what happens when kids make good choices, what happens when they don't.
Surprise party has arrived. What is she doing here? What? What's wrong? She's my sister. Yeah, she's my friend. It's not the point.
Travis, I can see there's a beer can right there. Keep your arms down by your side. Look down at your foot and count your steps out loud. All right, Travis, you can stop.
What would you do if one of your friends had been drinking and they asked you to get in a car and ride with them?
Now, Travis will need to have his day in court.
Add drugs and alcohol to that, and now you've got a disaster in place.
We value each and every student in Lee County. You are our future. Depend on you to make good choices.
Trey Boston here from the Beyond Belief Foundation. And I want to continue to tell y'all to make good choices in life about drinking and drugs. Talk to your parents, talk to your teachers, and practice what you say. And stay healthy. That'll make you an all-star every day.
At home, I've had the pleasure of going to the Drug House Odyssey event that happens every year. I went last year with Judge Sweat. He and I walked through it, and I have to tell you, I was deeply moved by it, especially the part where you're in the emergency room where the child dies. As a parent of now adult kids, sort of scared the hell out of me, and that's the point. So if you haven't seen it, it's really worth doing, and take a friend with you as well. So that's the end of our presentations, our third slate of presentations. We're going to move next to the last Q&A segment. And Megan, you have, I understand we have a bunch of questions.
Yes, we do. Thank you so much. The first question will be for Andrew's Anthem and Golisano, actually. So if you both want to weigh in on this, how do you think children are doing in the wake of this pandemic?
There we go. Sorry about that. So everything has changed for our children. If they've returned face to face, school looks completely different. A lot of activities have been canceled or have changed dramatically. Our children who are doing virtual school, that has changed for them as well. They're not engaging as many extracurricular activities or social activities. So that's not normal for our children. So we've seen lots of increase in just anxiety in our children and depressed symptoms as well. So it definitely has taken a toll on that. And then they are seeing their adults in their life, how they're responding to all the changes. They see their parents worrying and also changing the way they do everything. So it definitely has had an impact on our children this year.
Thank you. And if I could just add too, Andrew's Anthem, I know that you do a lot to build on resiliency for youth. You were doing it prior to the pandemic. So if you want to kind of tie in the work that you're doing to promote that and how it's affected in a positive way our youth going through this time.
Yeah, absolutely. Kids are having a really hard time, a really, really hard time, feeling so disconnected from other kids. And excuse me, so even like, for example, some kids that are coming to our programs now, they're doing school online, some of them, and then they're lacking that connection with other kids, and there's a lot of crying and a lot of upset, and I hear from the parents. So the kids are just really, they're sad, they're depressed, they're feeling really disconnected. And that's a lot about the work that we do, as you said. So creating those connections in that community. And when we started our programs again this fall, I mean, they filled up within a few days. People are really, really wanting a place for connection. The kids are really needing the tools that we offer right now, and hearing from them about how the practices that we teach are actually impacting their lives, where when they're having a hard time, they're able to calm themselves, they're able to get into their body and really sense what's happening and have the tools of just even the breath to be able to de-escalate and get through difficult times, practicing gratitude. And so when I hear from them how they're actually using the tools, it's like that's what we're about. So they really need it, and it's really timely, our work right now.
And Megan, if I may, just a bit piggyback on what they were saying. Last month alone, that we've received 43 calls from school-age students for crisis calls. So it has tremendously increased in regards to their anxiety and their depression, their isolation. So yes, that is a very good question, and thank you both for everything that you guys do.
Thank you. And JP, I believe we have an attendee from Lee County Schools that wanted to commend the Center for Progress and Excellence and the work that you've been doing to support the children in Lee County Schools. So we just wanted to add that, and our attendees, thank you.
Amen.
So our next question will be for the Children's Advocacy Center. Can you share more information on how to refer to the COPE program? Is there a referral on your website?
Yeah, so a lot of our referrals come from other agencies like DCF, but we do have a self-referral program. To get that initiated, you'll want to call our office, again, 239-939-2808, and ask them about therapy services, and they will get you in touch with the right person. You'll more than likely talk to our clinical director. Her name's Joanna, and she'll take you through the process.
Thank you so much. That brings us to an end for our questions. We can go ahead and pass it back over to Dr. Simeone.
Yeah, thank you all. Thanks to all the presenters, great presentations, and again, a slate of really wonderful questions as well. So thanks to all of you who put those in the chat box. Next thing we're going to do is I'm going to talk just a little bit about the care navigation program that Lee Health and Kids Minds Matter has stood up recently. I have to say this is a really important and near and dear heart event for me. When I first got down here from Boston, I met with Lori Brooks. Everybody knows Lori. She's the Director of Mental Health Services for Lee County Public Schools. And I asked her one question, which was, if we could do one thing for you, what would that be? And she said, we need care navigators. Now, care navigators are best thought about as like peer specialists. These are people who have lived experience with mental illness, who have successfully navigated through the system and through their families' difficulties with mental illness, and have done so either locally or in other places. So on hearing that, what we decided to do was to build an initiative with Lee and Collier schools, Kids Minds Matter, Suncoast Credit Union, and with the help of a few other private donors, we have gotten about $750,000 for this program. And so we have been able to stand up a number of care navigators, both in Lee and Collier County. And so it gives me great pleasure to ask Lorena to come and introduce her team, at least some members of it, and talk a little bit about this amazing project that we have ongoing. Lorena?
Hi, good morning again. So our Kids Minds Matter Mental Health Navigator program is uses a team-based collaborative planning process to actively engage parents in developing a care plan for their child who is coping with mental health and behavioral challenges. It is through that process that parents become involved in accessing resources to also address their basic needs. So it's, like Dr. Simioni said, it's a collaborative effort between the Lee and Collier County school districts, healthcare providers, and other agencies in the community. It is based on the SAMHSA system of care model. What makes it very effective is that our mental health navigators are experienced family members of individuals with serious emotional disturbances. So they provide this peer mentoring, and they really can connect to our parents who are going through very similar struggles that they did when they were dealing with their own family members. So the mental navigators can have up to 8 to 10 families. They are embedded within the school systems. And their goal really is to teach families to utilize the resources to advocate for their children. And the goal is that they will be able to do that without much help once they graduate from the program. So to speak a little bit more about this, we have 2 of our mental health navigators here today. And so I will pass it on to Joseph Craig, one of our mental health navigators, who will be talking a little bit more about the program.
Good morning. Another special concept of the mental health navigation program is what we call the Child and Family Team Meeting. It is one of the essential components of the program that separates us from other programs to be effective. And what that is a Child and Family Team Meeting brings all those supports that have been working with a particular family under one meeting. And with the parents present, we discuss specific tasks, assigns tasks to each one of the support services, and establish deadlines for each task. We identify potential barriers and needs from the perspective of more than one service provider involved with the family. It empowers each participant to be a stakeholder in the family stabilization on a bi-monthly or monthly basis. The Child and Family Team Meeting gives the team the opportunity to reach out to those who may not traditionally be brought in on as family stakeholders, such as aunts, uncles, cousins, friends, people that bus drivers, whatever may be having a direct impact on the family, we bring them under this one meeting. And part of the reason for that is not only to provide different perspectives on issues that we need to resolve, but also it develops a separate independent support system that the family can rely on after our program is finished. The team strives for consensus of members in deciding what measures need to be taken care of to address a particular issue or issues. By encouraging participation of the family's personal circle of supports to participate in CFTM, it may open up non-traditional and creative ways to resolve issues that maybe traditional support services haven't come up with. The CFTM, which is a child family team meeting, is also used in deciding how to use flexible wraparound funds to address financial shortfalls that may have impacts on a child's performance in school. The team develops financial plans with the family for long-term sustainability and within the family system. The child and family team meeting puts in place a practical way to follow the concept that it takes a village to raise a child. Since March of this year, the CFTMs have been used to help the child's performance and behavior and attendance in school, and we have seen dramatic positive impacts on grades and attendance, as well as behavior in the home. The children being seen by our program have improved in grade performance, averaging 63.5% in language arts before the program started, and ending the year with an average of 78% as a final grade, making a 15% improvement performance in just one quarter. For math, the average grade before the program began was 67% after the program started. The final quarter had an average of 79%, making a 12% improvement in math across the board. With regard to attendance, according to our latest report, students in our program went from only 10% having perfect attendance to 55% having perfect attendance, and there was a general improvement of 15% in attendance. To explain a little bit further about our program, I want to hand it over to my partner, Janine Sparks, who is also working in Lee County as a mental health navigator. Thank you.
Good morning. As Joe said, my name is Janine Sparks, and I am a mental health navigator working with students in the Lee County school system. So I want to talk a little bit about where our referrals come from and about our wraparound approach to providing services. Our referrals come from the school mental health teams. We get our kids recommended to us by the school. The school mental health team includes the counselor, social worker, psychologist, and nurse, sometimes the behavior specialist or an administrator. They are kids who are struggling in multiple areas, behavior, attendance, and course performance, or some combination of those factors. And they have not been able to respond to typical school-based interventions. So all the usual things that this school can do with them have not produced results. Schools or students referred to our program are usually those cases where the school and the family can't close that gap between what the student needs and what the school and family can do without outside assistance. And that's where we come in. As navigators, we provide that outside assistance, and we use, like I said, a wraparound approach. So what is wraparound? Wraparound is an individualized approach to supporting children and families with complex needs. It is child-centered and family-focused. We don't, one of our kind of guidelines that we use is not about us without us. So we do everything with the family. They are involved in every decision that is made through those child and family teams that Joe talked about. We look for the specific needs of each child and each family and what the barriers are that are preventing those needs from being met. And then we try to reduce those barriers, help the family meet the needs. Wraparound approach is a team approach in which we try to support and empower the family to meet the needs of their children. It is strengths-based and it's focused on outcomes. And so we give the family a voice in every decision that's made. We use the SAMHSA Systems of Care model, and so it lists the key aspects of wraparound as being a team approach, using natural and community supports. Decisions are driven by strengths and are, like I said, family focused. They're based on the specific needs of that child and that family. They are outcomes-based, and they're built towards sustainability for the family, because at some point, we're gonna step out. You know, when the family is more stable and they are able to address their own needs, we're gonna gradually, you know, taper out of their involvement, and we're gonna let them, you know, continue on their own, and that's the goal. So, examples of wraparound services that we have used in the last 9 months are connecting kids and parents to mental health services, providing transportation, helping complete applications for things like housing, financial assistance, or school enrollment this fall, you know, when they had to choose between Home Connect and face-to-face school, helping families access food resources, literally anything that helps increase the family's access to services and resources, and to help the child and the family function in a more healthy way. We've connected families to donated beds, sent kids to day camp, provided for emergency groceries and car repairs, bought school clothes, helped clients prepare for their driver's license test, and driven clients to medical appointments, whatever the pressing need the family has. Mental health navigators and child and family teams develop that support system for the family to help make sure they're stable and resilient and they can meet their challenges when, you know, once they've graduated still from the program. I want to share a real quick success story with you. It's a story of a young man that I'm just going to call B. He's in 4th grade, and he's struggled with learning and behavior for many years, since pre-K. His family's faced a lot of struggles over the last year, including homelessness, the death of several relatives from COVID and not from COVID, loss of contact with their dad, and loss of dad's income, and loss of the family car. So they've had a hard time. We've been able to work with local agencies to provide them with beds for 5 children. We've gotten new school clothes to replace some of the ones they've outgrown. And we've provided them assistance with the broken car. And we've helped mom to continue the youngest ones in childcare, you know, after, you know, her funding ran out. But more importantly, we've been able to partner with the school to find him a classroom where he can be comfortable and do his work. And we have begun the assessment process to find out why the traditional supports for students with learning problems have not worked for him. Because he's had an IEP since he was 5. And he's 10 now, and he's still struggling every single day. So we're in the process of getting him some specialized therapy to meet his needs, since what's been happening has not been meeting his needs. We're working with mom and the school to see if we can get his younger brother, who's just started kindergarten but is showing a lot of the same problems, trying to get some early intervention involved there so that he doesn't have to go on until he's 10 years old before he gets help. So I want to just close with a quote from Mr. Rogers. Okay, we all know Mr. Rogers. And this quote really says a lot about our program. We live in a world in which we need to share the responsibility. It's easy to say, it's not my child, it's not my community, it's not my world, it's not my problem. Then there are those of us who see the need and respond. And I consider those people my heroes. And everybody today fits in that category. And I want to thank you all.
Thank you very much for that great presentation. So we have just a few more things to go through. Hopefully you have a little bit more attention span left. The next thing we want to talk about, sort of under the banner of community initiatives that we thought you might want to hear about. The first is a joint venture that Lee Health had with Salus Care on developing what we call a multi-agency release. And since Lauren Walker, my trusty PM, had a lot to do with that, I've asked her to come up and just talk a little bit about it. Most of you probably know about this, but I think you could use a quick update. Lauren?
Hello, everyone. I have actually been here the whole time. So last year, when we did the first annual Region 8 Mental Health Fair, you may remember that we shared this form. We did partner with Salus Care in putting this together, and what the multi-agency consent form or release form allows is for a provider to provider level of sharing of mental health records and substance use when needed. So if you can see, I know it's kind of small on the screen and I can send this out later. We have over, I believe, 38 to 40 organizations listed on here. We really did try to incorporate everyone who could benefit from the use of this. If you see at the top, it has our Lee Health logo. When we sent this out about 3 months ago, when we launched it to all of the organizations listed there, we also sent a communication as to how Salus Care and Lee Health were able to get this through our legal teams and make sure that everything was within legal parameters to be able to share this information. And the reason that this is so helpful is because we know that these populations or cohorts of patients bounce around to a lot of the same organizations. If we could share that information with one another, how much better could the service and care for those patients be? So as I said, you see Lee Health up there in the top left corner. That logo is interchangeable to all of the organizations on this form. So the form stays the same. The logo changes from organization to organization. If you want to scroll down to the next page, we can kind of look at the information that's gathered, whether we allow this as a one-time sharing or whether the patient or individual shares that this can be allowed for a certain amount of time, whether it be open-ended for a year. And then again, it's just a great way of sharing the responsibility of taking care of these patients. So anyone's logo can go up in the top left. We sent this out about 3 months ago. We've gotten some positive feedback that some of the organizations were happy that this was put together. They're happy to use it. So moving forward, if there are any questions, we're happy to field those and answer them as best we can. Like I said, 3 months this has been out, so still kind of new. We really worked hard on it, but we're also proud of it, and we hope that this helps the providers in our community.
Thank you, Laura. Thanks very much. Just one quick comment about that. Just want to say that, there are lots of ways in which people are working together, and our goal at Lee Health and in the community is to integrate services as much as possible. And so we thought that this multi-agency release form with nearly 40 signatories to it would really help with that. And so we ask you to use it, give us some feedback about how it works, and we will continue to refine and develop it with your feedback and help. So thanks very much. Okay, the last thing I want to talk about before we end for the day is an initiative that I'm very, very proud of and delighted to talk with you about. So, okay, this is on. So this is the Healthy Minds Initiative. This some of you have heard about this. This is now up and running for the last month thereabouts. So the question is, what is this? So a little bit of backstory. In April, late March, early April, I began doing a lot of reading about the effects of COVID on the general population across the board. And one study that I'd recommend to you was published by the Wellbeing Foundation out in California. Very interesting group of people who did this very interesting analysis. And what they found was they projected, just on the basis of one variable, unemployment, mortality rates moving forward into the next 6 months. And we're now into those next 6 months. And what they projected was, just on the basis of unemployment, there would be somewhere between 75,000 and 150,000 additional deaths just looking at that one variable. When the study was published, they were using the number 75,000. Now, given where the COVID deaths are, we're now, I think, well past 150,000. So it got me to thinking about what we needed to do to help us help people in the community. So I began talking with Stacy Cook from Salus Care about this. And we began to talk about putting together a grassroots initiative to deal with behavioral health needs. And we all know that there is a significant increase in depression, anxiety, substance use disorder, domestic violence, suicidality, and psychosis. And so we had this conversation, very basic conversation after a meeting we had, and we decided to invite a whole group of people to come and talk with us about whether this was first a good idea and what we could do about it. So we now have 20 organizations who are helping us with this, many of whom have been represented here. And we are now going out into the community to provide screening, free, by the way, this is all free mental health screenings using a kind of a nifty screening device. We are providing resources. We have a resiliency and coping skills toolkit that we give to people, and we have a kind of a gift bag that people can take with them. It has hand sanitizer, masks, a kind bar, some magnets that provide information to, let's say, United Way 211 and other resources in the community. So this is a list of what we do. And what we do is both in Collier County and in Lee, there are events that are scheduled on a weekly basis. You can find these on the Healthy Lee, Healthy Minds website. And so, for example, last week we were in Cape Coral. There are a bunch of events that are down in Collier County. Tomorrow, we're going to be up in Lehigh Acres. And the goal really is to provide a kind of chill atmosphere whereby people can come and talk to volunteers. We have some really fabulous volunteers from FGCU and elsewhere. And this is an opportunity for people to come by and ask questions and get support for themselves, for friends and family members. So we just wanted to let you know that this was going on. If you want to find out more, there's the website. All of the information that we have is located on the landing page and is updated on a regular basis. This would include venues, dates, and times, behavioral health questionnaire, which is really the PHQ-9, the GAD-7, and the CAGE audit, which is a screen for alcohol and drugs. Full list of resources in both the Lee and Collier County, and of course the Resiliency and Coping Skills Toolkit. So if those of you who would like to be involved with this, Lauren, should we have them contact you or what? You can contact Lauren Walker if you want to be involved in any way. So thank you for listening to this. This is a really great thing that's ongoing, and I just can't say enough about all of the various people who have participated. We've gotten amazing, really amazing participation and partnership with people. So that leads me to my closing remarks. We're 5 minutes ahead of schedule. I'm going to say what I said last year at the end of our in-person event, which is just a simple message. First, I just want to say thank you to everybody who has participated in this and who have really helped out in the community over the last year. What I love about this event is that, I was saying this to JP, it showcases the huge amounts of really fabulous work that are going on in the community. And the reason why we put this mental health fair together was because it became clear to us that not all of us knew what sort of treasures were out in the community. And we heard a list of them today, a mile long. So I just want to say from the bottom of my heart that I'm so delighted that those of you who were able to participate both at home and here. Thank you for all that you've done. Thank you for presenting. Thank you for asking and answering questions. And thanks for your ongoing good work in the community. We've said it many, many times. We have a big job to do, especially during COVID. And frankly, with the upcoming election, we have a lot of stresses and strains in the community, in the nation, that are all around us, and they affect us and our family and friends. We need to help one another with this. So until next we meet, I want to bid you all a wonderful day and weekend, and thanks again. Be well. Be well, everybody.